Good evening, everyone, and thank you for attending this meeting of the Scrutiny Overview Committee. The meeting this evening is taking place with committee members, the Executive Director for Economy, Environment and Communities, and Democratic Services officers in attendance in person with appropriate social distancing requirements. Cabinet members and other officers are attending the meeting remotely. This is to reduce the number of people required to be in one room together. Voting this evening will be by way of a show of hands, which will be counted and reported back by Democratic Services. Committee members are requested to only switch on their microphones when invited to speak to ensure all contributions are clearly audible on the live stream. The agenda and reports for this meeting are available on the Council's website. To proceed and confirm that we have a quorum, I will introduce myself and call each committee member in attendance one by one to introduce themselves. So I am Councillor Murray. I am chair of this meeting. Councillor Nawaz.
Thank you, Chair. Councillor Nawaz, St Matthew's Ward.
Councillor Ali.
Councillor Ghazali for Berkshire Limo.
Councillor Paul Bott. No. Councillor Harrison. Councillor Hickin.
Adam Hickin from the Willenhall North Ward.
Councillor Hussain.
Yeah, Councillor Hussain, Blackwood, I can't hear and see.
Councillor Saab. No. Councillor Samra.
Councillor Samra, Streetley Ward.
And Councillor Singh Sohal.
Singh Sohal from Bedford Ward.
And we also have Councillor Ian Roberts. Okay. Thank you, everyone. Thank you, members. And I confirm that we do have the quorum for the meeting. As mentioned earlier, there are also a number of cabinet members and officers invited to the meeting to present reports and answer the committee's questions. I will be grateful if they could all introduce themselves as and when they are asked to speak. So we move now to item 1 of the agenda, which is apologies. I have one apology, which is Councillor Jevons. Does anyone know of any others?
Councillor Bott, please.
Any other apologies? No? Okay, so we go to item 2, which is substitutions, and I'm aware that Councillor Robertson is substituting for Councillor Jevons. Any substitute for Councillor Bott? No? Item 3, are there any declarations of interest or party whip? No? Okay, we move on to item 4, which is Local Government Access to Information Act 1985 as amended. And I just need your agreement that we move into private session for item 12, as it does contain commercially sensitive information. All agree? Thank you very much. Item 5, the minutes of the meeting of the 13th of December 2021 have been circulated. I just need you all to agree or otherwise accuracy. Do we approve those minutes for accuracy only? Yeah, all in favour? Yep, thank you for that. Okay, we move to item 6 then, which is our COVID-19 infection and vaccination rates update. So the idea of this item, it's a substantive item on our agenda every single meeting that we have. And first of all, it's to consider the latest data on COVID-19 infection and vaccination rates. So first of all, I'll call on Councillor Craddock, the portfolio holder, to introduce this item. Councillor Craddock.
Good evening, Chair. I'm Councillor Stephen Craddock. I'm the portfolio holder for Health and Wellbeing. Just a quick point of order. When Ian Robertson introduced himself, we couldn't hear through the video feed on his microphone. So maybe that's something that the clerk can address in due course. I'm happy to introduce the item, Chair. We've got a very comprehensive update on the data. The data in the report that's been submitted on CMIS is by its very nature a couple of weeks out of date. and Emma Thomas and Geraint Griffiths-Dale have put together this very comprehensive report. There's a lot of data in here, and I'm going to hand straight over to them to present the data on the report. Thank you, Chair.
Thanks, Councillor Craddock. Hi, evening colleagues and councillors. My name is Emma Thomas and I manage Public Health Intelligence. And yes, I'd like to share with you a number of slides that, as Councillor Craddock points out, we've put together to update the report that was sent out a couple of weeks ago. I'll just share my screen if you bear with me a moment. Hopefully you can all see that.
Emma, that's not the right screen.
Oh,
That's the one.
there we go. Phew. Brilliant. Right, so this you'll be familiar with from the report that was sent out, but it's just an updated version. So it's our usual barometer overview, which looks at our 5 key performance indicators and gives us a general flavour as to how things are going with COVID at the moment. The first one there, we can see that there have been 2,867 positive cases in the last 7 days. That is high to what we've experienced before. There was a peak at the start of the year in January, but things have slowly started to decrease, which is really encouraging. And at the moment, we're seeing a 22% decrease in the last week. We look at the weekly trends, those number of cases report to a rate of 1,000 per 100,000 population. So like I say, it is gradually coming down. We also look at the rank of where Walsall falls based on other lower tier local authorities, 1 being the worst and 309 being the best. And currently Walsall ranks at 174, so a little bit middle of the ground. So we're not brilliant, but we're not the worst. In terms of KPI 3, this is looking at the positivity. Again, we have seen a further reduction in that. We're currently at 20.1. However, we are a little bit higher than our counterparts for the Black Country and for England. They're faring slightly better than we are at the moment. The vaccination is KPI 4. That gives a little bit of an overview in terms of the age breakdown, but I will share some more detailed data shortly in some later slides. But generally speaking, we are performing better than our counterparts for both dose 1 and 2, and then on a bit of a par for the booster. And then finally, on this particular slide, the KPI 5 looks at the situational awareness, and that's the community transmission across the borough. Again, I've got a slide which details it a little bit more, but we're still red at the moment because all of the borough is currently impacted by positive cases. To supplement the 5 KPIs, we also have a couple that refer specifically to the acute trust. So these look particularly at the number of COVID inpatients at Walsall Manor. Again, these have fluctuated over the last sort of few days and few weeks. We're currently at 90 confirmed inpatients, and that has come down a little bit in the last couple of days. We also look at the critical beds which are being occupied again due to COVID, and this has come down quite a lot, in fact, and it's currently at 2. So just to explore a little bit more granular in terms of those positive cases, this looks specifically at the rates by age group. And this is a heat chart that is included within our weekly dashboard. The darker the shade in, the higher the positive rates. And I'm sure you can see there standing out the younger age groups, particularly those between the age of 10 and 14 and 5 to 9 year olds are our highest group at the moment. Much less, as you can see, amongst our older age groups, the 60 plus. And then in terms of the working age, it's a little bit of a mixed bag. We can break that down further by ward. I must stress that these do change frequently with the differences in the data. So currently, this is looking at the latter part of January, the last week in January, compared to the week before. So one particular ward at the moment stands out, and that is for Pelsall. That's currently seeing a significant increase. There are 8 wards there which have had a significant decrease, and then the remaining 11 have been fairly static with no significant change. But they do change frequently, I have to say. And you can see there in terms of the ranking, Bentley and Darlaston North at the moment with the highest rate compared to Brown Hills at the bottom there with the lowest. So you can just get a sense and a feel for the broad spectrum of the rates there that's being experienced across the borough. And I think I'm a lover of maps. I think this tells it really nicely. Again, a bit more granular than at ward level. This goes down to lower super output areas. So we have 137 of these in Walsall. 167. And you can see there that there's green across the board. All of them are affected. All of them are having some form of positive cases across the borough. But I've just highlighted with the red circles there a couple of areas where there's significant pockets. So these are showing sort of 30 plus cases. So there's a small area to the north of the borough in Bloxwich there, and then just a couple of pockets in Willenhall South and Darlaston South. But again, these will change week on week. Just to move on, what you'll notice in the report as well in terms of testing rates, this is showing the trends in testing, PCR testing that is, for Walsall, the West Midlands and nationally for England. They all mirror a similar sort of pattern, as you can see there, a bit of a peak at the start of January with testing, sort of after Christmas when cases were particularly high, and then they've all sort of started to drop down quite considerably. So, you know, we need to push that message still that testing is a positive thing that we can do to try and help stunt that transmission in the community. I'll just move on to the vaccination now. So there are a few visuals to follow these bullet points, but these bullet points sort of tease out the main points. So a bit of a mixed bag in terms of the vaccination. Generally speaking, yes, we are performing well, but there's a bit of a targeted approach I think we could take for certain age groups or certain ethnic breakdowns. So the 18 to 29 age group has got the highest number of vaccinated individuals, sort of just shy of 14,000. Towards the south of the borough, PCN1 in particular has the lowest uptake, especially amongst the older age groups, and the 50 to 59-year-olds particularly have not met their system targets. It's a similar picture as well for South 2 PCN. In terms of wards, Palfrey and Pleck have got the highest number of unvaccinated. Drilling down, I think the message is clear. We want to sort of target those 12 to 15-year-olds, really encourage that uptake. We saw the positive cases in that chart earlier on amongst the younger age groups, so we really want to encourage them to uptake their vaccination when they're able to do so. And as well amongst the ethnic breakdown, so a bit of a mixed bag there. So the British Pakistani ethnicity is currently at 26.5, so a quarter of those are sort of having their vaccination uptake. So I think there's some improvements that we can do there, and that's where the comms is so really important in terms of that targeted engagement. The community COVID champions can really help there, and you yourself sort of encouraging, educating to get that uptake of vaccination. This gives a little bit of a flavour in terms of the age breakdown. So we can see it's split there by partially vaccinated is uptake of dose 1, fully vaccinated is both dose 1 and 2, and then fully vaccinated plus the booster is all 3 of those. So the uptake is really good generally amongst the older age groups, and like I say, it's that younger age group that we want to do that push. And this graph just sort of emphasises that as well. Where we see the red, that's where individuals are yet to have a vaccination. So it just sort of evidences that message about the younger age groups and taking up that offer. And then apologies, this is a little bit busy, but this shows the vaccination uptake by ward, and we sort of see the red central wards there is where it's particularly low. So for Pleck, Palfrey and St Matthews and Blakenall in particularly. And again, sort of targeting on those 12 to 15-year-olds by ethnicity. So generally, the lowest individuals taking up vaccination is from a Caribbean ethnicity. And we need to do more amongst some of the other age groups as well, and the other ethnic breakdowns to encourage that uptake. Apologies, it's a little bit busy there, but it's just emphasising what was mentioned in the bullets at the start. And then just to finish, I just wanted to promote the weekly dashboard. So my team put in a special effort today to update this dashboard for you that's available on the website. But these are just some static shots of it here. If I can, I will just click on that and just remind you where you can find it on the Walsall Council homepage. So if you go to the red ribbon at the top there in terms of coronavirus, scroll down a little bit to the Walsall data, There's a pink button. Click on the
We're
dashboard.
still on the PowerPoint, in the website's not showing. I think that's probably come up when
Apologies.
you're
Apologies.
You're right.
Hang on. Thanks, Stephen. I'll start again. Is that showing now? Yep. Sorry, it's not. It won't share now. Typical. No. Apologies, technical technology.
So keep on with the slides, Emma. I think in terms
I
of us,
will,
we can
I will.
circulate
Apologies.
the link to members afterwards.
Yep, so that was my last one really, and then just to summarise, 3 things to take away from the data really, in that our positive cases remain high, but they are slowly starting to come down, but they are high. Secondly, in terms generally the vaccination is good, but there are some more targeted approaches that we need to focus on, and some sort of specific areas or age groups to target. And then thirdly, as evidenced in the dashboard that I tried to flash there, but failed miserably, but we have exceeded the 1,000 mark in terms of deaths with a 28-day of a positive test. So, you know, it's still with us, it's still there, there's still lots to do still, and we've got to find a way to live with it safely and to bring those rates down. But thank you. Apologies for the failure to share appropriately, but hopefully that's really comprehensive, and happy to take any questions.
Are there any questions specifically for Emma? Councillor Hussain?
Yeah, just a few questions. Yeah, thank you for the report for this. I think you mentioned about officers and what you call it, public health, and sort of officers working from home due to COVID-19 infection rates and COVID-19 pandemic. The Prime Minister of the country said everybody should go back to work in workplaces. We councillors and the members of the public are complaining to us about services and lack of services in the town hall. So my question is that when will we have officers, senior officers, coming back to the town hall and giving the services to members of the public? Because we are getting a lot of complaints that members of the public have gone back to work, we've gone back to work, we have physical meetings, we're doing our jobs. So it's not of any personal criticism. I know there's blended working, but people here are saying they're not getting the service and efficient servicing that they should be as they were before the pandemic. That's my first question.
Councillor Hussain, on that first question, it's a question that we're all asking, and I really do think it's a very, very important question. But I don't think at this particular point it's a question.
Because they mentioned something about it.
I know you've mentioned it, but it's not a question that either Emma or anyone here can answer. This is specifically about infection and vaccination. Right?
Yeah, yeah.
Returning to work, we will cover that. We'll cover it with the leader and people of that sort of level.
Okay.
So what's your second
Second question is about Fleckwood. The officer said something about the vaccine rate with the ethnic minority is quite not sufficient. Why is that? That's one more question. I've got further questions, but after that.
Okay, I'm not sure if Emma
can I start taking that one? We'd like to know why the vaccine rate isn't being taken up amongst those groups, Councillor. We've done a lot of work, and particularly with the COVID champions, pop-up clinics. We've done temples, mosques, other places around the area, and
Councillor, we're finding it very difficult to hear you. I don't know whether it's your Bluetooth headphones there, but it's very, very echoing. Thank you.
Have you got a microphone, Councillor Craddock?
No, I haven't.
You know, the headset.
I will try and speak slowly then.
Okay, thank you.
Yes, we've tried. We are trying everything we can to get the message out there. We've done a lot of work with the COVID champions in particular to target all areas of the borough, but particularly some of the ethnic groups. And we would like to get better engagement. We would ask that the councillors help us get that message across.
Okay. Third question,
Yeah.
Councillor.
The hospital it says here on page 16 about 0.6 Warsaw Hospital inpatient. There's 80 confirmed patients. Is that still the case? And there was 5 patients in HDU on ITU. Is that still the case at the moment? Are they reducing in our hospitals?
It's a question for Geraint.
Hospital admissions are continuing to fall, as is ITU usage. We still remain, as an NHS overall, in a critical incident, but Walsall Hospital has probably performed the best of the Black Country hospitals over the winter. We've maintained hospital flow at all times, and we expect those admission rates to continue to fall, and probably the national NHS incident to end in the near future.
Okay.
Yeah, final question. There's a report here, there's funding for lateral flow tests to continue up to December 22. And it says here that there's a few £100,000 that's still going to be supporting that. There was a rumor in newspapers that in the future, lateral flow tests will be for certain groups, and for other groups, they would have to pay for it. Is there any information about that going forward with the lateral flow tests?
I'm happy to pick that up. And Chair, just for the record, so Stephen Gunther, Director of Public Health. So with testing and ongoing support in terms of response to COVID, government are currently looking at policy. And we're sort of, as Directors of Public Health, through the Association Directors of Public Health, are working with government to advise on that policy, where the UK Health Security Agency picks up activity in relation to COVID, and also where local authorities pick up that action ongoing. That includes then local response and local outbreaks. That also includes testing, both PCR and lateral flow. And it also includes the ongoing sort of outbreak management plans and ongoing capacity with different organisations to respond. So that's an active and live conversation. As far as I'm aware, there's no policy decisions yet from government, albeit there may be rumours in the press. In terms of where I see it professionally going, I see specific and targeted action ongoing with vaccination, also testing, and also in the local outbreak management in any particular institutions, and obviously supporting colleagues through infection prevention control measures, as well as then the ongoing basics that still apply in terms of that sort of hands, face, space, and those protective measures. And that's just not for COVID, but also for any other communicable disease. As you may have seen, we've been promoting the sort of the MMR vaccination uptake as well. So again, another infectious disease, highly infectious disease, measles, that we are promoting that vaccination uptake. So that continues to be a response, and it will continue to be a response when COVID's out from the headlines. And at this time, we are just reviewing and revising our capacity and capability to continue to respond in those scenarios. Details are not yet confirmed, but we're actively working on it, Councillor.
Councillor Craddock, if you want to add.
Chair, just before we have any more questions, and partly answering Councillor Hussein's question, we're only halfway through the presentation. There's a section coming up on communication and engagement, and a lot of the questions that Councillor Hussein had regarding how we're getting the message out there is in the next section of the presentation. I don't know if you want all of the presentation and then ask the questions, because some of it might be covered in the subsequent part.
Okay, Councillor, it's a good point. Yeah, if you could ask whoever it is that's going to present next then to present their part, please.
Thank you, Chair.
So I'll ask Emma to drive, and I'll be the backseat narrator, if that's all right. And just picking up the sort of communications actions, and then picking up the questions there about who and where and how we're targeting. I think Councillor Craddock correctly so alluded to, there's quite a lot of information in that bit. So again, so the Director of Communications, Keith's not here today, but a majority of his team and his work, and also the communications cell. So I hope I do it justice. And again, working with partners, say grant and team within the NHS, as well as our acute as well. So in terms of the communication strategy, as we've said before, we've got a communication cell that meets regularly. That includes partners across Walsall, but also outside of Walsall, to make sure we've got those clear and consistent messages and targeted messages with those communities, again very much based on the intelligence of what you've seen, so the particular age profile, the particular ethnic profile, but also geographic profile of communities. And that very much targets the sort of channels. If I go into communication speak, so whether that's traditional channels in terms of news, BBC Midlands Today or radio, as well as other channels, whether that be social media, but also importantly the word of mouth on the street corners, in the community centres, and also in those faith institutions, etc. So a whole range of different channels in which we're engaging. And I'm going to sound like Chris Whitty now. So next slide, please. In terms of highlights, I think what we've done on and again for marking 2 years of our response, we've built up a lot of capability and capacity to be able to really hone in our messages. And as I said, in terms of middle bullet points there, we've used the range of sort of traditional media, including Midlands Today, radio, West Mids, ITV, 3 Radio, Expression Star, Birmingham Live, again being really key channels in terms of getting those messages across to the community, and being consistent with those messages where we do know there is misinformation out there as well. So again, I would recommend anybody looking at those consistent channels for that information, rather than any channels to get that information on COVID. And again, I would highlight our website and the national websites to get that verified information around COVID. COVID champions have also been really crucial. I was like, that's fine, Emma, we can go to the next one. And again, as to say, those different languages and presented in different ways, whether they be verbal, visual, or in written form in those different languages. We've also had some very specific targeted, as we've highlighted here, in terms of the data. Blakenhall being one of those areas where we've got high case rates and also low uptake of vaccination, having those specific banners looking at what it means to me in my community and also my ward and my place. As we know, Walsall is many communities as a whole, whether we're from Blakenhall or Walsall or Pleck, or even Aldridge, etc. So it's that targeted approach, and it does continue to have an impact, and it does make that behaviour change. What we do see, and a continued trickle, is those people coming forward for first vaccination, as well as those coming through their second and booster. So that targeted and specific approach has worked well, and has served us in terms of engaging those communities that are hesitant. In terms of those key messages, again, working through the national NHS communications, and those specific messages in terms of that narrative, we have been doing that amplification locally. So what tends to work is the national messages and locally specific amplification. And then you may have seen, unfortunately myself, but most probably better, portfolio holder doing their messages for getting people to take those key actions. And those messages which we've said time and time again: safe and effective vaccination. There's over 1 billion being delivered across globally, and again has stopped and slowed the spread of COVID. And sort of the phrase that's been sort of bandied around that vaccination program as particularly defanged COVID, and again making it less severe and really important. We're also just here just really to make sure that we've got the other local voices. So we've had lots of vox pops with people of why they've taken it up, but also the local pharmacy, and also specifically targeting pregnant women. And that was a key area of focus for our last scrutiny meeting. So again, making sure that we've got that message out to particular and different cohorts is really important. Next slide, please, Emma. As I mentioned, our community champions, our COVID champions, are in the sort of next phase. Again, you can see a whole range of different pop-ups, conversations, and supporting the uptake of vaccination, And again, lots of stories there. And I think what's really important is those stories coming forward, those individuals that may have thought twice about getting the vaccination but eventually come forward for good reason, and also those that have ended up in hospital and wish they'd had it as well. So again, those personal voices and making that real to people of the borough has been really critical for us in terms of getting that message across, and also lots of engagement there with individuals through our community champions, and they will continue to provide those messages across the community. So in terms of key messages coming out for us, again, it sounds boring. It is quite boring, and it does get quite boring. However, they are really effective. So again, hands, face, space, particularly encouraging the use of face coverings. And as we're seeing really high rates there in our young people, the 5 to 19-year-olds, our COVID rates are 10 times higher than they are in our 80 plus. So again, really important messages there for our young people to take those precautionary measures. Also, in terms of fresh air, again, we know this is a airborne respiratory virus, and getting that fresh air and flushing it out is really important. Regular testing. So again, if you're going out to meetings like you are today, if you're going out to other events, again, that regular testing is really important. That symptom-free testing, lateral flow testing, and again, if you're unwell, to get that complimentary, also that PCR test as well. So they are still available, albeit has slightly changed in terms of the national guidance. Continue to use the app, but more so and more important, get vaccinated and get boosted. Doesn't matter if it's if you haven't come forward before, come for your first, come for your second. And if not, come for your third. And for those that are still available, come for your fourth as well in some cases. So in terms of those key messages for us, those really are the key messages, but also then in terms of the vaccination availability is across the community. Just walk in and there's plenty of capacity to uptake that vaccination, even if it is your first. So I'll pause there unless Grant or the portfolio holder wishes to come in on anything further.
Councillor Craddock, do you wish to
only a brief one, really.
Yep.
Can you hear me all right now?
Yes.
Is that any better? I've changed these over, but anyway, I think just a couple of points from what Stephen and Emma have presented to you is that we have actually reached the milestone of 1,000 deaths in Walsall now, which is obviously very sad for all of us, and I don't think anybody has escaped being touched by losing somebody they know, a loved one, a relative. And I know there are people in the meeting today who've had that. We need to be very careful. The rates are coming down, but actually the requirement to get a PCR test if you've had a positive lateral flow test has gone. So unless you need to record it for your £500 isolation payment, or you need to record it for an employer, there are a lot of people now who are testing themselves, being positive, but it's not going on the case rates. So there is a lull here. We're lulling ourselves into a false sense of security. You know, these positive cases are still happening and they won't be in the case rates. It's really important to get vaccinated. There are still people out there who are vulnerable and shielding and have been for 2 years. So those people, to those people who haven't been vaccinated, please get vaccinated. I'm not going to use any descriptive words because they're too emotive, but the more people that are vaccinated, the more protection we have from the virus, the sooner the people who are actually shielding can come back into the community as well. So it's really important to free up those beds in the hospital for other treatment and to get that vaccination. It's safe, effective, and it protects you and your family. I don't know if Geraint wanted to add anything to those comments.
Just to say, we continue with our capacity in community pharmacies, and we've moved back to delivering the vaccine in your local GP surgeries as well. So we're making them as accessible as possible. Since we went back to the pop-up services at GP surgeries, we have seen a rise in the number of people coming forward for their first dose. So that's really positive. And just to reinforce the message. Anyone who wants to come forward for a vaccine, the capacity is still there. It's available in your local surgery. It's available in your local pharmacy. It's available at the Sadler's Centre. If you want to have the vaccine, no one's missed their opportunity, and we can still deliver it for you.
Councillor Bird.
Thank you, Chairman. I just wonder whether either Stephen would just repeat the wards where we are low. I think there were 4 from memory: Blakeney, St Matthews, Palfrey and Pleck. I think those were the 4. I have to say that we need people like Councillor Hussain, Councillor Aftab Nawaz, because there is a great concentration of their community in those areas. I see many communications when something is being done good, like extending the section of the cemetery, sadly, for the Muslim community, which everybody wants to take credit for. But here we have an opportunity where elected members should be, and hopefully will be, a lead in getting our foothold into the community they represent. Because unless we can get that vaccination rollout out, every time one of those individuals goes out, A, they're susceptible for infection, but if they are asymptomatic, are susceptible to pass that on. So I would call upon the councillors in those wards to do everything possible through the mosques and in the temples to ensure that we do encourage people to get that vaccination.
Thank you, Leader. Councillor Robertson.
Thank you. Have you had the infection rate being infected cover from the various branches of the NHS absences? Are there any trends of that? What's the rates of measles vaccination now being affected by the fact that we've got vaccinations at every corner?
Anyone able to answer that?
I think I heard most of it, Councillor Murray. One was around, just to clarify, was that, Councillor Robertson, the impact of vaccination overall and the MMR? Sorry, it was difficult to hear on the, it was a bit intermittent on the speaker.
Would you like to repeat the question, Councillor Robertson, closer to the mic?
Right, okay. I was just wondering if the infection rates have had an impact upon various branches of our NHS, such as the health service and absences, etc. And I also wondered if the MNR vaccination rate has actually gone down now because we pressed for COVID vaccinations.
Okay, I'll take the second question if Geraint can take the NHS question, if that's all right, Chair. So we know that COVID is going to have a knock-on effect on a whole range of different diseases, whether they be communicable or non-communicable. It's also going to have a knock-on effect of whether people take up screening, whether they take up routine immunisations, and whether they take up and present at their primary care facility when they have signs and symptoms. We know that's going to happen. We also know that we're likely to see additional strain in terms of sort of mental well-being, hence sort of set out our sort of mental well-being strategy that was signed off at the Health and Wellbeing Board in additional investment. The campaign, particularly for MMR, particular parts of Walsall had seen a low uptake pre-pandemic, below the 95 sort of target, but it has been slightly exacerbated by the last 2 years where people haven't taken up that routine immunisation. And again, part of the national campaign that we're locally amplifying is making sure that we do take up those routine immunisations. And again, something that myself and team, but also the Health Protection Forum that reports into the Health and Wellbeing Board is closely looking at. And also the Health and Wellbeing Board signed off the health protection strategy. So things like MMR, things like routine screening, presentation to cancers is sort of key priority from myself, but also colleagues in the NHS. We know the distraction, if I describe it like that, for the last 2 years is going to have knock-on effects in terms of other diseases. And again, part of the recovery plan, I'm sure Geraint can talk a bit more from an NHS perspective, but from my perspective from public health, we'll be making sure we've got those preventative measures in people to take up their routine immunisations, but also screening, also really, really important. And again, clear message that those screening clinics, those immunisation clinics are still open, still available for people to uptake those. But I'll hand over to Geraint in terms of the impact on COVID in terms of staffing.
I think we saw two impacts in the period in the sort of run up to Christmas and then through January. One was we saw the increase in hospitalisations as Omicron took forward, but probably the biggest impact was on staff absence. We saw our sickness rates and isolation rates rise to probably the highest we've seen throughout the COVID period. And I think that was exacerbated by the fact that in the last wave, we continued with planned care. You'll recall a lot of our planned care was suspended in the early waves, but we've kept as much capacity open as we can, because you'll be aware we've got around 160,000 people waiting for a planned care hospital treatment across the Black Country at the moment. One of my leads is on elective recovery across all 4 hospital sites. We now have patients waiting up to 2 years for non-urgent planned care. That is starting to reduce. Our longest waiters have now been treated, and we are also reducing the amount of time people wait who require the most urgent surgery within 28 days. But it's the sort of the less urgent, less life-threatening surgery where we're seeing the longest delays, and we have a significant number of people now waiting over 52 weeks for care, and that's going to be the focus of the next 12 months as we recover, is less so on the immediate urgent care service, but on reducing that planned care backlog.
Thank you, Geraint. Councillor Nawaz.
Thank you, Chair. Just a couple of questions. Of course, we're all promoting people to get vaccinated in all communities. We're one community rather than separate communities. And I'd say, no, quite clearly, everybody should be encouraged, and everybody should be encouraging others to take the vaccination. My question, of course, is a bit relating to schools. So Boris Johnson, and I know we can't believe everything that comes out of his mouth, but he did say that people in schools should take the masks off and get back to normal. But yet schools have been given, are they being given the same advice on a national level? Are we out of kilter with other boroughs? Where are we currently with our advice to schools? And secondly, I guess as a borough, are we out of kilter with the advice that's coming from government? Get back to work, get back to normal. We're on our way to recovery. So are we out of sync? Because we're hearing things that we're saying for our borough. Are we out of sync with the rest of the country? Thank you.
Yeah, happy to take those. So in terms of advice for schools, as we sort of highlighted with the infection rates, our current school rate is 10 times the amount in the sort of 5 to 19-year-olds than it is compared to our 80+. That is the cohort which has the majority of cases, and also the cohort where it has the knock-on impact on both parents and carers, but also then in terms of the economy, where people are isolating at home and therefore carers have to be at home to support their children. So it has a knock-on effect. So in terms of our advice, we've written out to all schools recommending that where they have cases, which is within the guidelines from the DfE, that it is recommended that they wear face coverings within communal areas. Again, that is a key strategy and clear evidence that reduces transmission. It's a minimal impact, but actually a large gain, and that recommendation has gone to schools. So it's within the DfE guidance, which talks about sort of outbreaks, so where we have cases in schools. We're still recommending that they wear face coverings within the communal areas. Again, we have done that since October. Our heads, I will go on record to say, have been fantastic, and they continue to be fantastic, working with us. And again, their staff across education facilities, not just in schools, but the college and university have also been fantastic, supporting those to keep people, which is the primary aim of the policy, to keep people in face-to-face education. On the second matter, in terms of work, again, as I say, picked up by the chair previously, I know there's going to be further reports coming on that. We will continue to advise in relation to the guidance around face coverings and ventilation, etc. As just a reminder to colleagues, we still have high rates, and we'll continue to use that in the context and how we advise and take forward, but it's not to me to make those decisions in terms of working practice. We will advise on the current rates, and they will be made decisions will be made accordingly.
Okay, thank you. If there are no more specific questions, can I just ask, is there anything that we want to, any specific information that we want bringing back to us at our next meeting? Because this item is on every single one of these, this particular scrutiny overview committee meetings. Is there any specific information? We've done this in the past when we've asked for specific information on the uptake with pregnant women, for instance, and that sort of thing. So to give our officers the opportunity, is there anything specific for the next meeting, or is it just another ongoing update? Anything specific? Just before I come to our leader, can I just ask members then? Nothing specific for the next meeting? No? Okay. Councillor Bird, leader.
Yes, Chairman. Just for members who are in the room, there is a report going to Cabinet on Wednesday, which I've had. It's come out late because I've been insisting that we do look at the issue of staff coming back into the building going forward. And there is a report there on blended working and how the managers will be encouraged to see that the departments that we have within the structure are manned either by on a rota basis, I should say, or indeed where there is an opportunity to use technology, and then we will. But there is a move now to look at more blended working going forward, and what that does mean is we'll see people back in the building. So can I urge members to pick up that report from the CMIS, which, as I say, was sent out late today at my instructions that it should go to Cabinet as quickly as possible.
Thank you, leader. Okay, so if there are no more questions, then that concludes item 6. Just for me to thank Councillor Craddock, to thank Stephen, Emma and Geraint, and no doubt we'll see you all at our next meeting next month. So we move on to item 7, which is the corporate plan monitoring Q2. And can I ask again our leader, Councillor Bird, to introduce that item? Councillor Bird.
Thank you, Chairman. Well, as you can see, the key thing is that the items that are on red is where we have the markers of success below where we want it to be. The amber is 42%, where we were close to target, and obviously the green one means we've met the target or exceeded it. So as a result, I think the short answer is 92% of our measures of success are certainly there or thereabouts. There's still a way to go, but I think it just shows the hard work that's been put into achieving our markers of success during what is perhaps been the most taxing time, certainly since I've been around. And the priorities, or the EPIC, the acronym of EPIC is still there, which is economic growth, people, internal focus, children and communities. And I'm certainly not going to miss an opportunity to congratulate our children's services on achieving good for our children's services, which I think is the first time I've seen, probably as the longest serving member in this meeting, might be almost the second or third longest serving member in the council. And we've come a long way from where I had to apologise to the children that we had failed in many years back, but it just shows the hard work that's gone in to achieving that success. And I think whenever you get success, you should start singing from the hilltops at every opportunity, so that people out there do understand. It's easy to put down Walsall councils, oh, well, they're this, they're that, the other. But when we do something good, I think we should sing the praises of everyone involved. It's easy to get things wrong, but when you get things right, I think it's right and proper to say we've got it right. You always get remembered for what went wrong. You never get remembered for what went right. So I think the report is quite good news for us. And I think if Stephen wants to pick it up on there, Chairman, I'm happy for him to do so.
Thank you, Leader. Stephen, if you can pick that up now, please.
Yeah, no, thank you, Leader. Thank you, Chair. I mean, just to say, as the Leader outlined, we have seen some progress in terms of those. We've sort of from quarter 2 to from quarter 1. Just to say, quarter 3 will be coming shortly. That we have seen an improvement overall, a reduction in the number of reds, so a 4% reduction, an increase slightly from the reds to amber, so 42 to 45, and then 50% from 39 in terms of the green. So as the Leader says, progress being made, very difficult times, and services and actions, progress still being made across the authority. Just to remind Scrutiny as well, we will be having the new, if agreed by Cabinet, council plan coming forward then on to council. It will have a slightly different set of markers of success, and again, that's natural as part of the evolution of these things, and this report just sets out quarter 2 of the 21 to 22 plan, but more than happy to take any questions if Scrutiny has them.
Thank you, Stephen. Members, questions? Councillor Robertson.
Thank you, Chair. I mean, one area of children's services which still stays red, and I'm interested to know what the trend is now of the number of children that go missing. I think it has been raised at Children's Scrutiny Committee. I'm interested to know if that trend is now still increasing or has it dropped?
So happy to pick that up, and to say with Children's Services will be able to respond. And as you say, Councillor Robertson, it was brought up in Children's Scrutiny. I think the Children's Services, the Leader outlined, overall got good in terms of their Ofsted, but as alluded to, still more work to do. The overall trend, I believe, is improving, albeit a lot of work from Children's. And again, encourage if members wish to have a specific session on any of those measures that are either red or amber, to have a specific session there. In terms of the officers, will be able to give a much more granular level of detail of the actions underneath that.
Thank you, Stephen. Members, any more questions? Councillor Hussain.
Yeah, thank you. Where are the challenges you reckon on this item, and any issues that you're facing or you face?
I heard most of that, Councillor. What were the challenges? Is that correct?
Yeah, sorry. On this item, where do you feel the challenges are, or any serious issue you think you'll be facing going forward?
But happy to pick that up. And so in terms of the overall monitoring of this, so this goes through our directors group and then on to corporate management team, and then reported quarterly to Cabinet for detailed. Obviously, each portfolio holder has an understanding of their portfolio and got a grip with the officers there to go through any specific issues or areas for development. And again, that's that ongoing working relationship. In terms of the measures, we said we've got a few off target. Particularly there around our apprenticeships, and also in terms of the public realm and sort of safe community spaces. But we know we've got the portfolio holder in terms of resilient communities that may be able to give a bit more detail in terms of the latter one, and then in terms of the economic one, in terms of the apprenticeships piece. I've got the exec director if he wanted to give any further information on that as well. I don't know if the Leader wanted to come in.
Leader.
Yes, indeed, Chairman. One of the challenges we face is convincing people that this pandemic has not gone away. That's a big challenge, believe me. And the second biggest challenge, of course, is they aren't printing any more money from central government, irrespective of who might be there. And so therefore, we have to make sure that we are becoming more of facilitators rather than providers. And to do that, we have to work with our community and encourage them to do as much as possible by engaging themselves with council services. Some of those services can be delivered now by access to the website. Our biggest challenge now is to encourage people, very much I've said, like what we're looking at in the future is to have a podium, very much like you'll see in McDonald's, for those who have the unfortunate pleasure to go into those establishments with their grandchildren. And you go in and you touch the picture and you order it. That's exactly where we want to get to engage our residents in being able to access Walsall Council services 24 hours a day at their convenience. So that's also a big challenge, by using technology to educate our upcoming youngsters, because the older people still knock on the door and the piece of paper. But the biggest challenge by far is encouraging people to understand that this pandemic has not gone away, and living with COVID going forward is something that should be top of everybody's agenda, no matter what service we provide.
Councillor Higgin.
Thank you, Chair. I note that there was a street scene strategy that was being drafted and presented to Cabinet in December. Just wondering, did it go, and what progress has been made on that?
Sorry, Simon, did you want to answer that? Or?
Yeah, happy to take that. Yes, the street scene strategy went to Cabinet in December, which was agreed to put the shape of that strategy together, together with public consultation, which I think we're to launch probably from next month, to see what is important to everyone, and then come back to Cabinet later in the year, probably in autumn, the final strategy for agreement.
Okay. Any more questions? Or do any of our portfolio holders or officers wish to make any further comments on this item of the corporate plan? If not, okay then, we can just thank Stephen again and move on to item 8. Item 8.
Chairman, before you move on, can I just correct you a little? It's now been renamed at our request to a council plan rather than a corporate plan. Corporate plan, I think people thought it was an officer thing. The council plan is what we're all involved with, officers and members. So just a slight correction, if I may, Chairman.
You certainly may, Leader. Thank you very much for that. And Craig, Democratic Services, if we can take that on board. Are we okay with that, Craig?
Yeah, that's the name for the plan, which is going to be agreed by Cabinet on Wednesday.
Oh, you jumped the gun slightly there, Leader. It hasn't been agreed yet. You're going to agree it on Wednesday. But I take your point seriously, Leader.
I would hate to think this was pre-decision scrutiny, but I just wanted to flag up there are some very important reports going on Wednesday.
Yeah. Okay. Thank you, Leader. Thank you. Okay. So if we move on to, we're happy, we move on to item 8, which is the proposed action tracker for overview and scrutiny committees. This is a follow-on from our previous meeting, and we do have, well, we have some examples in our pack, 3 examples, 1 internally and 2 from one of the council and one from the police. And we have a proposed sort of model. So can we have comments on that or discussion on the proposed model and on the other examples, please?
Do you want me to come in, Chair?
Yes, please, Craig.
Okay. But yeah, just to sort of to add what the chair just said, upon your request at the last meeting, we undertook some benchmarking to look at good practice from other councils and also from within Walsall Council. What we found was that it was all fairly straightforward. You know, things like who was responsible, what was the item, what was the action. So in one of the appendices to your report, I think it's 8A, there's an example. It's all coloured in blue. This is an example action tracker that we could adopt at Walsall Council. And in this, I've included the actions that arose from the last meeting to kind of give you an example about what it would look like. Most of which are against my name. So I was very pleased for the first action tracker to include those. So that's kind of what we're proposing. As you can see, just the date of the meeting, what the item was, what was asked for, who was responsible, and the status update and some notes. As you can see, the majority either completed or ongoing, and it kind of identifies where the gaps are. It helps us to kind of in the office to chase people to. So if you're happy with that, we proposed that we would take that to each meeting and roll it out to the other scrutiny committees, so we can sort of collectively and develop a more systematic approach to tracking recommendations.
I actually just have one comment on the model that's proposed, the one in blue, which is obviously just picked up from the other 3 examples that we've had, which is that I would like to see a column on there, which is the target completion date. It kind of like is a little bit open-ended. And I think at the very end, if we said, right, completion March 2022, something like that, then at least we have a target time for. What do members think of adding that column?
I'll second that, Chair.
Okay, thank you. Any other comments or points at all about the model that Craig has proposed? If not, we'll take that on board, and then we'll use that in future and roll that out to the other scrutiny committees. Right.
No, thank you, Chair. And just another proposal for the recommendations that we can do a report in a year's time, kind of come back and just reflect on it to see how it's worked, if there's any improvement we'd like to make.
Yep. All in favour of an annual review? Yep. Thank you. Okay, so we move on to item 9, which is the feedback from overview and scrutiny committees. Now, we have a printed report from each of the overview and scrutiny committees, but we always do in this meeting, we always ask the chairs if they want to elucidate on anything or add to it. And the first one, unfortunately, education. Councillor Jevons isn't present, and I don't think we've got anyone, any other members from education, have we? No, we haven't. So we'll have to take that one as read as is in the pack. So children's scrutiny, which is Councillor Hickin.
Yeah, thank you, Chair. We last met on the 31st of January and we covered primarily 2 items of importance. One was the transition from children's to adult social care and all of the surrounding kind of recommendations and things that need to take place for that. It's something that the Scrutiny Committee has looked at for some months now, been trying to at least. Part of that, there's a toolkit being developed as well to help social workers so that when you've got people moving from children's to adults, the social workers will have better guidance on what's available for those. And we've also looked at the youth justice as well, which I don't know if people noticed, but was also on the tracker. And that's levels that we don't want to see increasing as well.
Okay, thank you, Councillor Hickin. Councillor Hussain.
Thank you. There is a brief report here, just to elaborate a little bit. We met a couple of weeks ago on the 20th of January, and there were a couple of items that are written in the report. One was the merger of our services from urology group, the New Cross Hospital. There's been a delay in that, and COVID has caused infrastructure delays. So that's going to, this service from Warsaw Manor Hospital to New Cross will be delayed till April 22 now. But that will get us, so we had a report back from the relevant officers. It was David Loughton. So we'll get some further feedback later on about this. Other one was the CQC report that we had for Warsaw Manor Hospital. That report was early in the year, March, and there was a lot of issues with inspection of the hospital, and there were several issues highlighted that needed improvement. And the hospital, with David Loughton's leadership now, has been working to improve them. Most of the things within weeks and months have been improved drastically with better working, better management, more staff, and more resources. So that's improved. That's reassuring. So we're monitoring that every 6 months on our panel. We had another report on the CQC on the maternity section of Warsaw Manor Hospital. There were some severe issues there at the maternity side of Warsaw Manor Hospital. David again has pinpointed where the issues are, and straight away he's got onto them, and he's got a plan there, and that action plan he's got more staff in and better leadership. So he's assured us that they will improve very quickly, and they are. So these are 2 items we dealt with most recently. Thank you, Chair.
This desperately looking for my notes and it's not downloading. But anyway, I haven't really got much else to add to what's on the report. Only that our next meeting, we have shuffled it about a bit because Combined Authority coming in to give a presentation on, I think, local transport plan. Okay.
Okay, thank you, Councillor. Anyone else wish to speak at all on that item, item 9? No? Okay. If not, then we'll move on to item 10, which is our areas of focus. We have an updated council forward plan, which was circulated to you before the meeting. We obviously also have the Black Country Executive Committee, the forward plan for them. On either of those two forward plans, does anyone wish to comment or wish to take anything from those for our own scrutiny committee? No, nothing at all. Okay, so the final part of this item then is for us to agree our agenda effectively for our next meeting, which is only a month away, on the 15th of March. So, as you know, we always have the COVID-19 data update, so that will be on the agenda. We also have Chief Superintendent Phil Dalby of the West Midlands Police, who was delayed from a previous meeting, so we've got that lined up for the 15th of March. Anything else that you would like to be added to that meeting, to that agenda? Just trying to find the, here they are. The items that we still have to schedule. Obviously, we've got the 2 working groups, but I'm informed by Craig that we're still not quite in a position to start those yet. We have affordable housing, fly tipping enforcement, the West Midlands Combined Authority Scrutiny Committee. We've been trying to get that for the last 2 years, every meeting as far as I'm aware, and COVID Memorial Garden. So I'm aware that Cabinet will be discussing and debating COVID Memorial Garden at its next meeting. And so of those items which are still to be scheduled, do we want to add perhaps one of those to the 2 that we had for our March? Councillor Hickin?
I'd be interested for the fly tipping enforcement.
Craig, would that be feasible? Okay, wonderful. Okay, so for March then, we have the items as laid down, plus the fly tipping enforcement. Are we all happy with that for March? That's wonderful. Thank you all for that. Move on to item 11, which is, as we've just said, date of next meeting, which is March the 15th, 2022. And we move on to the final item, item 12 in part 2, which is private session. So if we could ensure that the public are now excluded via transmission or whatever format, and then we can continue. Craig.